Hi, I'm John Cullen. Welcome to another episode of Just the Facts. In this episode, we're going to take a look at the maps. We're going to take a look at some of the data coming from the CDC and the World Health Organization. And we're going to take a look at some of the discoveries that we've had over the course of the last couple of weeks and how do they apply to the stories that are in the news today. This is Just the Facts. I'm John Cullen. Thanks for joining.
So me and Julio go over to my neighbor. I just moved into the neighborhood. I don't even know the guy. I knock on the door. The guy came to the door, had a full medical mask on. If you have a medical mask on and you answer the door, that's got to be the first thing out of your mouth, okay? Why you got this damn thing on? I come to my door with a medical mask. I take it down. Listen, doing some painting in the garage, gets into my lungs. That's why I got the mask. This guy, nothing on the mask. Started talking through the mask. He's like, what's going on? I go, no. What's going on in here? I just bought the joint next door. Do I gotta put it up for sale? Why the hell do you got a medical mask on a Monday morning, okay? Let's get into that. I'm gonna send Julio in your yard. Is he gonna come out with no head? What are you doing with the mask?
In this episode of Just the Facts, I want to introduce you to another map. So this map, similarly to the map that I started my investigation with. So this is the ESRI map that many of you have seen on television. This is used by a number of different people to look at the outbreak throughout the world and to zoom in and find out details. And for those of you who have been following along, this is a system that I helped architect a little over 30 years ago, and it gives us a lot of information about the outbreak. And we can go to different parts of the world using the software and find out about the outbreak in different places, and we can get different data based on what we're looking for. So I've been using this map to zero in on aspects of the outbreak that are outliers. And recently, I found this map. I found this map at Bloomberg, not Johns Hopkins. And what's interesting is the Johns Hopkins School of Public Health is the Michael Bloomberg School of Public Health at Johns Hopkins. And then this is the Bloomberg map. So it seems that the team behind these maps at both Johns Hopkins and at Bloomberg, both of these groups of people, whether it's the same person or not, I don't know, but both of them don't really understand map design. And as one of the pioneers of geographic information systems, I'm pretty well qualified to comment on this. So here is my comment. In this map that you're seeing from Bloomberg, the question is, why is nothing in this map any color other than the red? What you're seeing are just shades of red. There's no green, there's no yellow. And in standard design of dashboards, what we're looking for is red, amber, and green. What is good, what is on the verge of being bad, and what is bad. And then certainly you can have different shades of red. But when I took one look at this map from Bloomberg, it became clear to me that it was deceptive. Now, I'm also the author of the paper that was published back in October of 2020 that claims that not only has influenza activity been reduced in Australia, Chile, South Africa, and the USA, but in dozens of other nations worldwide. And this paper asked the question, has it been eradicated, like smallpox? And so I published this paper back in October. My qualifications in geographic information systems led me to start looking at this map with a critical eye. And what I noticed very quickly was that countries like Mongolia, with only 2 people dead and a tremendous border with China, was still colored red. And I was wondering, well, why would you do that? Why would you color Mongolia red if there's only 2 people dead in the entire country? Same thing with Thailand. Thailand has the same population, in fact, a slightly larger population than France. And with right now it says 83 people are dead in Thailand, and there's 80,000 dead in France, with a slightly smaller population, but about the same, about 70 million people in each one of these countries. And so I couldn't understand, well, why would you color Thailand red? Why would you do that? If it has 1,000 times fewer dead people than France, that doesn't warrant a green. Nothing here gets a green, okay? What about Vietnam? They have 100 million people and 35 are dead, and it's still colored red. Why would you do that? Mainland China, according to Bloomberg, has less than 5,000 people dead. So why is it red? If mainland China has fewer people dead than Arkansas, if mainland China has fewer people dead than Iowa or Ohio, why would you color it red? Why wouldn't that be green? It has fewer people dead than DeWines, Ohio. And it's red? Okay. So my work has been focused on analyzing the data from the CDC. And what we've been doing here is looking at the CDC's mortality data. And we've been looking at all deaths involving COVID from the CDC versus deaths from all causes versus the comorbidities to try and put things in perspective in just a fact-based manner. And what we find is that although there's a lot of talk right now in the United States about reopening the schools and doing it safely, what we find is that there's only 72 school-aged children. And by that I mean from 5 to 14 years old. So this is school-aged children from kindergarten to 8th grade. In the United States, for the entire duration of the pandemic, there are 72 children dead in this age group from 5 to 14. And so with that, the United States is looking to spend about $180 billion to reopen the schools. You may have seen some coverage of this aspect of the story, that although COVID has been claiming so many lives, flu activity is unusually low this year, and that the flu-associated hospitalizations in the last 4 months is remarkably low. In fact, unusually low, lower than ever before. And so this takes us back to the paper that I published back in October that said that based on the observations of the data that I'm making from the WHO, there does not appear to be influenza anywhere except for a handful of countries. And so the question that I asked in this paper is, how did that happen? How is it that all of the masking and social distancing activity that supposedly eliminated influenza didn't lead to an improvement in COVID deaths? In other words, COVID deaths actually got worse at the latter half of 2020 into January and February of 2021 in the United States. Yet, when we look at the World Health Organization's reporting on influenza, it appears that as of week 11 through 14, 15, 16 in 2020, influenza pretty much just went away. And so you will see this story in a number of places, but it's important to understand that the paper that documented it, I published this in October of 2020, and I based the paper on research that already came from the CDC. In other words, the CDC had already documented that there was very little influenza activity in South Africa, in Chile, in Australia, and the United States. So what I did was I just built on that research and said, yeah, and Austria, and Sweden, and Switzerland, and all I did was go get the charts. Right? It wasn't really that complicated. And by taking the data from the WHO, I was able to build on this paper from the CDC. And that's what I published. And so as a result of this data from the CDC, we're able to really get a much better understanding of who is most at risk from COVID-19, from SARS-CoV-2 and the COVID-19 disease. And what we see here in the data is that this is for the United States, and this is as of February 17th, 2021. And if you look down the left-hand side, you'll see different age groups, under 1 year, 1 to 4. So down the left-hand side, what we see, first of all deaths involving COVID, 460,234. Now, for some reason, all the way out to the right side, right before they tell us the population, which is 328,239,000, they give us this number, which is deaths involving pneumonia, influenza, or COVID-19. I was sort of like, well, that sounds a little bit like a shell game. Why would you bother to conflate data from influenza? Why did you need to do that? You already told us how many people died involving COVID, and now instead of 460, you're talking about 650,000 people. So what did you add here? You added deaths involving pneumonia, influenza, or COVID? Well, how am I supposed to know what's what? That's a little bit complicated. If I go 2 columns over to the left, I have deaths involving COVID-19 and pneumonia, excluding influenza. So we know that 219,974 people didn't have influenza. Okay, so that's helpful. And then over here we have 460,000 of the total that died. So the delta between 460,000 and the 200, and call that 220, is about 240,000 people that I guess are the ones that did have influenza. If we go down the left-hand side, what you'll see is that for infants under 1 year, there's 45 that have died in the United States. So of the 460,234 deaths, 45 of them have been infants under a year. And of those 45, how many of them did not have influenza? We go out 4 columns, and it's 7. If I look at 1 to 4-year-olds, there are 23 dead in the country, and of those 23, 3 of them did not have influenza, excluding influenza. So those were deaths involving COVID-19 and pneumonia, but not influenza. So the 23, 3 of them didn't have the influenza. 5 to 14 years old. So now we're getting into school-age kids. So this is your kindergarten through 14, which I guess is about 8th grade. And in the United States, there are 72 children that have died from 5 to 14. Now, the next column over is interesting because this shows us deaths from all causes. So in the United States, 5,810 kids have died from all causes. 72 of those died with COVID. And of the 72, how many of them did not have influenza? It says 13. Deaths involving COVID-19 and pneumonia, excluding influenza, 13. Then we go up to 15 to 24-year-olds. So this would be high school kids, college, and graduate school. And there aren't even 650 in the whole country. 648 have died from 15 to 24. But what's remarkable is we go to the next column, deaths from all causes, 37,548 kids in this age range have died. And of those 37,548, only 648 are from COVID. And then how many of those kids did not have influenza? 250. So we're looking at deaths involving COVID-19 and pneumonia, excluding influenza, 250. Okay. So when we look at the data this way from the CDC, so this is the CDC's table, we can get a much better understanding of who's most at risk. And when we go down to the bottom of the table, we see that 146,000 of these deaths were people 85 and older, and then 128,000 of them were 75 to 84. And then we add in another 100,000 people 65 to 74, And what you see is that we've got 100, 200, 360, 74, 374,000 people have died from 65 and older. And you can just see that right here real quick. All right, so that seems to be where most of the risk is, not down here with the children. It just doesn't seem that way based on the data. The other thing here on the show is we don't give any medical advice here. The only advice we'll give you is talk to your doctor and check the CDC and FDA and World Health Organization's websites for information. We don't give advice here. Just look at data and look at maps. So I recommend you go to the World Health Organization website, go to the CDC website, go to the FDA website, and form your own opinions from the data that you'll find there. According to the World Health Organization, they recommend against the use of remdesivir in COVID-19 patients, although that's the only approved therapeutic in the United States. This past week, UK Column featured some of the video content that I published earlier in the week about root cause analysis. We did a show called Crash Course on root cause analysis, and our friends at UK Column featured that video clip, and a whole bunch of folks that are familiar with the work that UK Column does came over to the Johnny Hoover channel and subscribed, and so it's great to have you guys. Welcome. And this team of folks at UK Column is dynamite. Their research is top-notch, possibly the best group of critical thinkers I've seen working together in the UK. And they featured some clips from our video. I'm very, very grateful, and I want to encourage my subscribers to go over, check out their work, and please subscribe to them. They are just top notch. So tip of the hat to them, and a big thank you. When we look at the United Kingdom, we did a show together with UK Column back in October of 2020, and I think I commented in that show that the United Kingdom was down to something like 11 or 13 deaths per day. It was a very, very small number. And if you look at the top chart here, it's showing daily deaths in the United Kingdom, and back in October was remarkably low. And I think I made a comment to Alex Thompson and to David Scott, and I said, you're not going to be able to maintain two diseases in the UK. In other words, you're going to have to rob from Peter to pay Paul. So if coronavirus is going to continue, you're going to see influenza disappear, or influenza is going to come back and coronavirus is going to disappear. But you can't possibly have both of these things happening at the same time and lots of people dying from both. I just don't see that happening. And sure enough, if we look at the World Health Organization's report on influenza coming out of the UK, it shows almost no activity for the latter part of 2020 and going into the beginning of 2021, yet daily deaths from coronavirus are worse than they were back in the early part of 2020. So the second peak in the UK was worse than the initial outbreak, yet influenza is gone. Okay, so that's what's happened in the UK. Also in the news, I'm seeing a whole bunch of stuff about how there needs to be more equity in Hollywood, and that there aren't enough female directors and things of this nature. And so it appears that people are starting to use a litmus test of how many people of a given sex are there in a particular job. And if there aren't enough female directors, that seems to be something that we need to talk about. Well, I think I found all the female directors. I think I know where they're working. But yeah, this seems to be, for some reason, this is important. How many episodes are directed by males and females? How many episodes are directed by different ethnicities? Caucasian versus African American. I'm really not sure I understand why this is relevant, but okay, so there's 66% male directors and 34% female directors. Is it important to make that a 50-50 ratio? And if it is, well, I know where to go get the female directors. I did another research project a couple months back, and I asked, does sex matter? And I said, well, might this be the second Nobel Prize for Medicine that I'm nominated for? Because no one is looking at coronavirus this way. No one is looking at chromosomes. If coronavirus was killing twice as many women as men, that wouldn't be relevant. We wouldn't want to know about that. We would keep that a secret and not tell everybody. Why? Why would we keep that a secret? Is coronavirus killing twice as many women as men? Well, it's killing twice as many of one sex. So whether you're XX or XY, coronavirus seems to care about that. But nobody wants to talk about that. They want to talk about Hollywood, and they want to talk about how many episodes have been directed by men versus women versus how many people are dying that are men versus women. I seem to think this is more relevant, but that's just me. It seems that regardless of age group, we are looking at, in the United States, almost a 2-to-1 ratio of one sex over the other that is dying from COVID. You guys know I'm not really interested in case counts and hospitalizations. I'm interested in how many people are dying. The fact that case counts are going down is great. It's a leading indicator. But I'm interested in deaths. And what I see is that things are not the same. One particular combination of chromosomes appears to be much more susceptible to the disease than the other, but nobody wants to talk about it. They want to talk about Hollywood. So the question is, does sex matter? Well, according to the data, twice as many of one sex are dying as the other, just about, almost 2-to-1. And that's not relevant. We don't want to talk about that. We don't want to know which one is bigger than the other. Why not? Why don't we want to talk about that? What else would we not want to talk about? Would we not want to talk about other relevant factors? Well, it turns out that if we look at the school teachers in America, more than 3/4 of them are female. That's where all the female directors are. They're teaching school. So what we're going to need to do is shift. We're going to need to take a bunch of these female school teachers and send them to Hollywood to direct TV shows. And a bunch of the Hollywood TV directors are going to need to become school teachers if you want to balance it out. But the net of it is there's 77% of the school teachers in the United States are female. 24% are male. So now the fact that one particular chromosome group is dying more than the other, what factor does this have when you look at the makeup of school teachers in America? If more than 3/4 of them are female, and females are dying at a rate of 2-to-1 over males, hypothetically speaking, would that matter? If it turns out that males are dying at a rate of 2-to-1 more than females, would that matter? More than 3/4 of the teachers in the United States are female. One of these sexes is dying at a rate of almost 2-to-1 over the other sex. We don't want to talk about that. That's not relevant. We don't want to factor that into the safe reopening of schools. I have a plan that I think the American Federation of Teachers is going to love. I think my new best friend is Randy Weingarten. Randy Weingarten's the president of the American Federation of Teachers, and I just did some math that Randy, I think, is going to love. The government has been talking about spending $180 billion to reopen the schools safely. When I did the research, what I found out is that there's approximately 3 million school teachers in America. The average age is 42 years old, and the state with the most male teachers is Wyoming. What we could do here is, given that there's 3 million teachers in the United States, well, there's a couple things we can do. One, we can vaccinate them all in 2 days, because we now know that the United States is averaging about 1.5 million vaccinations per day. So that means we can vaccinate all the teachers in the United States in 2 days. So if you want to get your vaccination, there's really no reason why it should take more than 48 hours to get all the teachers in the United States vaccinated, and then we can move on. Now, if a teacher doesn't want to get vaccinated, certainly that's their prerogative, but we got to get back to school. So let's get all the teachers vaccinated in the next 2 days or so. Certainly it can be done in the next week. If we're doing 1.5 million a day and there's only 3 million teachers in the country, it shouldn't be that complicated. But the math gets really interesting. The average salary of the 3 million teachers in the United States is just a little bit less than $60,000 a year. And what that means is we can spend the $180 billion trying to reopen the schools safely, or we could double the salary of every teacher in America to $120,000. Give every teacher an extra $60,000. That's $180 billion. If we doubled the salary of every teacher in the United States, but we put the responsibility of safely reopening on them, and we said, but you guys are going to be responsible for pick up the Lysol, the alcohol, etc., and you're going to be responsible for the social distancing and all that. And we're not going to hire any new nurses, but we're going to double your salary. So my question is Randy Weingarten going to like my plan? Rather than spending the $180 billion on this, all these different complicated things, just give it to the teachers. Teachers will figure it out. Teachers know what to do. They know where to buy Lysol. They know how to get masks. If we doubled the teachers' salaries with $180 billion, that I could live with, and then make the teachers responsible for the safe reopening of the schools. Otherwise, I'm not real sure what you're spending all this money on. But the net of it is that teachers are the average age of the teachers is in the 40s. Most of the teachers are 42, 44. The average age is 42. And we see the median age is 40.9. And that's the makeup. I mean, we know that 76.5% are female, 23.5% are male. So what is the risk factor? Well, it turns out that men are dying at a rate of twice as many men are dying as females. So if 3/4 of the teachers in America are women, and most of the people who are at risk are men, what kind of risk profile is there for women in their 40s, which is the average age of teachers in America? And what kind of risk is there for the children? Well, it turns out that there's not that many children dying. 72 kids between the ages of 5 and 14 have died in the United States out of 5,810 total deaths from all causes. So it's really not that big a portion. Now, we know that 200 million doses have been administered, according to Bloomberg. The latest rate, 6.24 million doses a day, which is remarkable. So there's really no reason why we can't get these teachers all vaccinated in a 2-day window if we wanted to. But when we start to look at the comorbidities and we start to look at, well, what else is killing these kids? It turns out that there's more kids that drown than died from COVID in this age group. So now what I'm looking at right now is birth to 14 years old. So this includes infants and little tiny kids. But you've got drownings, 698 drownings versus 140 kids died from COVID. So this yellow slice with 140, that's COVID. The gray with 1,089, that's traffic accident, that's collisions. And 229 in green is stroke. I didn't realize kids died from stroke. I've talked about that before. I didn't even know this was like an affliction. And then drowning, 700 children have drowned. So almost, 4.5 times what we have here on COVID. And then 27,000 deaths from other causes, poisonings and other things. So when we look at COVID compared to other causes of death for children, it does not appear to be the biggest risk that the children are facing. And when we start to break down school teachers into different age categories, we find out that most of the school teachers are between 30 and 49 years old. And that, yes, there's a group that's at risk that's older than 55, and there's a group that's 50 to 54. But most of the school teachers are not in one of these high-risk categories. And when we start to look at what are these causes of death for different age groups, we see things like suicides and homicides and poisonings in 15 to 24-year-olds, 4,245 poisonings. And we've got a combination, we've got less than, I think we said up to 24 years old, we had less than 750 dead from coronavirus. So with 6 million shots a day of the vaccine, is there a good reason that we can't vaccinate all the teachers in the United States in a 2-day period and get back to school? So a couple quick questions for Dr. Fauci. Dr. Fauci, just a quick update, has the Pfizer vaccine yet been approved by the FDA? According to Pfizer, it has not. So if we check the Pfizer website, if you guys go to Pfizer.com products, and then you go read about the vaccine, it says, I'll read it to you verbatim, the Pfizer-BioNTech COVID-19 vaccine has not been approved or licensed by the U.S. Food and Drug Administration. Now, it does go on to talk about emergency use authorization, which is a completely different scenario. And it also says it's for use in individuals 16 years of age and older. So just, again, we don't give advice on this show. We just point you to where you should go to get your advice. Go to Pfizer, go to Moderna, go to CDC, go to the FDA, go to the WHO, and talk to your doctor. That's the only advice I have. Dr. Fauci, has the Moderna vaccine been approved by the FDA yet? And according to Moderna, the answer is no. So it says the Moderna COVID-19 vaccine has not been approved. This, I'm at the Moderna website, has not been approved or licensed by the U.S. Food and Drug Administration. But it is emergency use authorization. But again, that's very different from being approved. So be sure you understand the difference. And I thought it was fascinating that Moderna was able to design this vaccine in just 2 days, thanks to this mRNA technology. So that's somewhat remarkable. And we're going to talk a little bit more about that in the show. Also, make sure that you read the safety analysis. So Moderna and Pfizer both provide safety analyses on their vaccines and talk about the age of the participants in the clinical trials. And it's probably important for you guys to read this stuff and make sure you understand what the safety analysis looks like. So go to Moderna, go to Pfizer, and read what they're sharing with you. This particular Pfizer insert is for medical professionals, showing them how to handle the vaccine material, how to thaw it, how to shake it, etc., what temperature it needs to be maintained at. So again, it's complicated stuff, and it's not something you want to take lightly. So if you're going to get the vaccine, make sure that whoever's giving it to you is handling it properly, and that at least they've read the instructions and are following those instructions, because you wouldn't want to get a tainted vaccine that wasn't thought out properly. Nobody wants that. Dr. Fauci, to what do you attribute the accidental eradication of influenza, and why did the methods intended for COVID-19 work in the influenza world but not COVID-19? In other words, why didn't we just mask up and social distance back in 2017 when 80,000 people died? And if it was so effective eradicating influenza, why was the second node of the COVID-19 outbreak in the United States worse than the first node? You would think if it was effective at eradicating influenza, it should have eradicated COVID also. So is there a good explanation as to why these methods eradicated influenza, but COVID got worse? That's what we're trying to figure out. And the influenza, pediatric influenza system, showing us deaths still at 1. So this is still a real weird outlier. The fact that we've had 188, 144, and 195 children die from pediatric influenza in the last 3 seasons, and this season we're still at 1, is somewhat remarkable and I guess, somewhat awkward. I've got a clip for you I want to play of Dr. Fauci talking with Brett Baer. And in this video clip, Brett Baer asks Dr. Fauci, effectively, is the John Cullen white paper talking about the eradication from influenza, is it accurate? Would you say, Dr. Fauci, that John Cullen's white paper saying that influenza is gone? Was John Cullen correct back in October of 2020 when he published this? So let's take a look at this video, and let me run this for you here.
Because of what we're doing with coronavirus, we haven't heard a lot about the seasonal flu. We lose 30 to 60,000 people from the flu. Has that gone down dramatically?
Extraordinarily dramatically, Brett. And in fact, that is a very good testimony to the efficacy of wearing masks, avoiding congregate settings, and keeping distance, because we did that during this late fall, early winter. And the level of influenza in the community is remarkably low regarding comparisons to other years. Our Australian colleagues, we don't have hardly any flu this year, and we think it's due to the fact that people are wearing masks, keeping their distance, and avoiding congregate settings. Goes to show you that those types of public health measures actually work.
Well, the question is, if it worked on influenza, why didn't it work on coronavirus? So we're looking at Belarus. There was no influenza of significance in Belarus after week 10. It was just gone. Bangladesh had a second outbreak, but it did disappear in week 11, but then showed back up in Bangladesh in weeks 36, 37, 38. Here's Austria. Disappeared. Week 11 was the last significant week in Austria. Here's Australia. Dr. Fauci was just talking about Australia. And you see how after week 11, when they had about 100 specimens, it just drops off. And by week 18, there's almost nothing for the remainder of the year in Australia. The problem is that I've been looking at the mortality system in the United States, and the mortality system tracks death certificates, people who are already dead. And the mortality system showed us that over 4,000 people were dying every week from pneumonia and influenza, not coronavirus. 4,000 a week in the first dozen or so weeks of 2020. There was no coronavirus killing people in the United States of significance. In fact, on March 13th, when President Trump declared a national emergency in all 50 states, there weren't even 200 people dead in the country on March 13th. Every single week leading up to that, 4,000 people died of influenza PNI, pneumonia and influenza, in the PNI system. Then coronavirus shows up and eclipses the pneumonia and influenza deaths. The green that you see here in the chart is coronavirus. So coronavirus comes along, eclipses the pneumonia and influenza deaths, but then pneumonia and influenza back down in the valley exceeds coronavirus and exceeds coronavirus in the next valley again, and then coronavirus passes influenza. This is how we know that the two systems are not double counting. In other words, if the influenza system was counting all the coronavirus deaths, the influenza system would always be higher than coronavirus. So it's not. The fact that the coronavirus deaths can go higher than the influenza system means the influenza system was not double counting. It was counting pneumonia and influenza. And the fact that we see that one is higher than the other in some cases and the other is higher than the other in the other cases means that neither system is counting the other deaths. So we had two outbreaks at the same time, as evidenced by the coroner's data. So the coroners are telling us, but all these people died with influenza, pneumonia, and coronavirus. And that is a tremendous discovery. This is what it looks like as influenza heads into the coronavirus outbreak. And the absurd supposition would be that influenza just simply stopped. So it went from 4,000 people a week, 4,000 people a week, 5,000 people a week, and then just disappeared. That's never happened in history. So any epidemiologist will tell you, well, that's unrealistic. So what did happen in that next week? And what we see is that influenza went up and then came down, independent of coronavirus. And this is how we know that these systems are in fact independent. One of them tracks coronavirus, one of them tracks influenza. And when we watch influenza and we watch week by week as coronavirus arrives, influenza goes up. But then coronavirus catches influenza as far as how many people are dying from it. And then in the next week, coronavirus eclipses influenza, but influenza continues to climb. So these are two discrete systems tracking two discrete viruses. Both of them are claiming lives at a rate that is increasing in weeks 12, 13, 14, 15. It's going up, up, up. But then in week 16, the influenza deaths come down while the coronavirus deaths go up. Those are two different systems. That's discrete data. That's not double counting. If it was double counting, that couldn't happen in either system. Influenza goes down again, as does coronavirus in week 17, but you start to understand why something has to be up here. There's two infections. There's coronavirus and influenza, and that's okay. And this is from the coroners. This is the P&I mortality system at the CDC. Now we know that the WHO did not find out about the outbreak from China. We know that the WHO found out about the outbreak from ProMed and from the ProMed facilities in Boston. ProMed has staff locations around the world where they monitor health activities. And it was the ProMed office in Boston that notified the WHO about the outbreak in Wuhan. Oxford University is extending COVID-19 vaccine study to children as young as 6. All right, real quick, what do I have in the browser right now? Just looking at the data. New deaths, how many people are dead? 2,096 new deaths in the United States, a total of 500,017. Compared to India, it's pretty remarkable. Let's just sort by population. And when I sort by population, you see that China only has 4,600 people dead. That's less than Arkansas. India has 156,000 dead. But the population of India is almost 1.4 billion. 1.388.79 billion. So with almost 1.4 billion people in India, they have a fraction of the number dead that the United States has. So the United States with 517,000 dead and India with 156,000 dead based on the population, and then China with 4,600 dead. This is kind of hard to understand. And then we go to Indonesia, and Indonesia has 275,000 people. Okay, so they've got, about 60 million less people than the United States. But they've only got 35,000 that have died, not 500,000. Pakistan, 12,000 have died. Brazil has a big number, 249. In fact, I think Brazil is number 2. Yeah, Brazil is number 2 in the world with 249,000. Mexico is number 3 in the world with 181,000 dead. India, 156,000. The UK, 121,000 in the UK. It is horrible. Just terrible. 1.4 million people died from tuberculosis in 2019. That's a tremendous number. So would it be a good idea to combine the tuberculosis tracking system with the coronavirus tracking system? Should we do that? Should we track coronavirus and tuberculosis in the same system? I don't know. There is a vaccine for tuberculosis. It's called the Bacille-Calmette-Guerin vaccine, the BCG vaccination. It's not offered really in the United States. And the question is, well, why? Why is the BCG vaccination not really offered in the United States? And the answer is because tuberculosis doesn't really kill that many children in the United States. So if tuberculosis doesn't kill that many children in the United States, they don't vaccinate them for it. All right, I want to talk a little bit about this video that Project Veritas released earlier this week, and then we'll wrap up. Because this is going to take us into another direction. I'm going to do a crash course show on CRISPR-Cas9 and mRNA and the relationship between them, and I think we need to look at that more closely as a result of this video that's from Project Veritas. So Project Veritas, James O'Keefe was able to pull up a clip of Mark Zuckerberg talking with Fauci about how these vaccines work, don't work, what they do, what they don't do. And I think it's important that we take a look at this. Also, remember, on this show, we don't give any advice. We don't make any declarative statements. We ask a lot of questions. But typically, we're going to look at sources like MIT and Harvard and the CDC and things like that. So Facebook is removing misinformation about COVID-19 vaccines. Here's an MIT article about what are the ingredients of the Pfizer vaccine. So again, there's a lot of really good data that you can find out there if you use good sources. What I'm curious about is Fauci's understanding and Zuckerberg's understanding of what mRNA is and what mRNA vaccines do and how they work. And so I think it's important that we take a look at this video clip and see if, what do we think? What does Fauci understand? Does Zuckerberg understand? So let's take a look at this video and let's see what we think of this.
We just don't know the long-term side effects of basically modifying people's DNA and RNA.
DNA is inherent in your own nucleus cell.
We just don't know the long-term side effects of basically modifying people.
Last week, Facebook announced they are, quote, expanding their efforts to remove false claims on Facebook and Instagram about COVID-19 vaccines. Let's take a look at Facebook's most updated COVID-19 vaccine policy. The real kicker is right here in the policy where Facebook says it would remove any content that, quote, claims the COVID-19 vaccine changes people's DNA. Well, we just got a new leaked tape from Zuckerberg himself, the CEO of Facebook.
I share some caution on this because we just don't know the long-term side effects of basically modifying people's DNA and RNA.
So that's all we have for this show. Thanks for joining. I'm John Cullen.